Hello, and welcome to the technique and supply review for accessing a port, dressing change, and the flush protocol. One of the most important things when you're accessing a portacath is the length of the needle. The gauge is important based on what you're going to infuse through it, just like a peripheral catheter or any other catheter. But on a portacath, how it sits on the skin is very important. So if a patient is rather small from a height and weight perspective, usually a 3/4 inch will do. If the portacath, and I'll show you in just a moment what that looks like under the skin, but if a portacath is, the septum is kind of sitting up on the skin a little bit, somewhere between either a 3/4 inch or 1 inch is going to work. And if a patient weight and height indicates that they might need a little longer needle, then there's of course the 1.5 inch. So it's important whenever you're taking on a new patient or going to see them that you understand what length of catheter or needle is going to work to reach the back of the septum so that you can withdraw blood and make sure that your placement is good. Your hospital and clinic nurse are a great resource when you're trying to figure this out. Sterile procedure is something that we'll absolutely go over, and I'll reinforce that remaining sterile during this particular skill is extremely important. You want to make sure that you don't contaminate the site. An RN should always perform this procedure and not hand it over to a patient or a caregiver. And the patient and the nurse must wear a mask. So let's get into the actual review of the supplies. So what we provide for you is a dressing kit and sterile saline syringes that can actually be dropped onto the sterile field. What's different about that from the other 20 years that I've been in home infusion is usually you had to figure out how to keep one hand not sterile and have one hand that was sterile, or have other types of supplies that you had to draw up the fluid because you couldn't drop a non-sterile syringe onto your sterile field. We have the clave connector on the end that will go at the end of the procedure. And we have the LifeGuard safety non-coring needle. The important feature about a non-coring port accessing needle is that it doesn't take pieces of the septum away when you put the needle in. So let me show you on chest here what it looks like under the skin. Kind of help you be able to see what you're going to aim for. The septum sits right underneath the skin, so if you had someone that was rather heavy, you have to really feel for it, whereas some people it kind of sits on top of the skin, or you can feel it on top of the skin. The area you're going to be trying to put the needle into is this little white area here, and it's good for so many sticks with a non-coring needle. So make sure that's, regardless of the brand, what you are using whenever you do the skill. So let's put him back there. And let's prepare our supplies so that we can show you how to access the portacath. So as always, I would inspect my supplies to make sure they're not wet or damaged or torn in any way, which would affect my ability to use them because we have to have sterile supplies. I have already washed my hands and explained the procedure to the patient, of course. And when I open up a dressing kit, again, I always open up the entire dressing kit and take the lid off. So that if I ever have to reach in there, whatever, I'm not doing so with sterile hands. Taking out my sterile field, and this is what I use for any garbage or debris that I might have that I'm not going to just put into my garbage can. Whenever you're preparing your sterile area, you of course have cleaned and disinfected your area here, but when you open up your sterile field, you want to make sure that you're going to only touch the edges and not inside your sterile field. And sometimes, depending on how it's packaging, that can be a little fun because it kind of wants to fold back on itself. So I just take my time doing it very carefully. Like that, see? So on this sterile field, this area here is not sterile. So when I drop my supplies on, you want to make sure that you're not putting them toward the edge. I again use the technique of grabbing whatever's inside the packaging, dropping that on my field, opening up the Lifeguard Huber non-coring needle. I have a tendency to say that name brand just because that's what I kind of grew up on, placing years and years ago. And then adding my clave. And if you do it just like that, it can easily pop out. But if you hold it like this, you can remove the paper and drop. Now, for the purposes of this video, we're not going to apply the mask to me or the patient, but I certainly would during the procedure. I'm going to reach and get my gloves and move my sterile field over some so that I can apply them. Again, when you're talking about a Portacath access, sterile is extremely important. Usually patients that have a Portacath have some type of diagnosis that requires them to get infusions, and their immune system can be compromised. So be very careful with this. You grab the outside cuff here and you put your fingers through and use the cuff to pull it on. And then the second glove, you put your fingers underneath the cuff and then slide your fingers through. Being careful to only touch your sterile gloves underneath the cuff, and your hands are sterile. This area is sterile, so you can do this and remove it. If I'm going to move this back toward me, I'm not going to grab the edges. I'm going to grab the center like this. This is just a piece of paper that explains the contents, so I can put that away. I can prime my needle and go ahead and put my clave on there by removing the safety cap. Placing that snugly on. And again, these are sterile. The ones you get for peripheral starts and stuff are not, the outside of the syringe are not sterile. To prime, you simply would gently push until a drop or two comes out at the end. And again, you want to make sure you put it on your sterile field, not too close to the edge. Now let's get the site prep done. Chlorhexidine prep is used again. To activate, you would squeeze this. This allows the fluid to reach the sponge area. Remembering, if for some reason you do use alcohol or iodine, you're going to, on the alcohol swabs, you would start in the center, just like you would on a PICC line or anything. Start in the center and work your way out with 3 different ones. Allow the alcohol to dry, and then use the iodine and do the same procedure, never going back into the circle. The difference between that, since alcohol cleans, it does not kill all the germs. The iodine does that. With the chlorhexidine, it does both. So you're able to scrub a full area to get it cleaned. And then allow it to dry. Putting that chlorhexidine swab into that little garbage area. Now the Portacath is one particular skill that if you happen to need to use, again we talk about the length of the catheter, for comfort of the patient, sometimes a nurse will put a gauze underneath the wings, or it's a little too tall for the patient, they'll put that underneath there. INS does not require, with the Portacath only, it to be every 48-hour change of the dressing. But we're not going to use that today. Now let's talk a little bit about the lifeguard. The lifeguard has this little mechanism right here that the wings, when you're placing the needle into the patient, this is down and you're using it like this. When you are removing it, this is up, and I'll show you that at the end. Now this is how I hold my sterile syringe in order to place it. I remove this cap. You want to feel for the septum and feel for the center. Hold it very sturdy. And I'm going to hold Mr. Chest here and go in straight until you feel the back of the septum. You would then be able to check to see if you had a flashback and flush to make sure that it flushes without a problem. If for some reason you were to have your syringe hang or drop and you forgot to put it in your fingers, then what I usually do, if that happens, is use the gauze in order to flush. So just make sure that you know that you're remaining sterile. And then we apply a dressing over the top. So let's talk about how to remove this. Let's say we had the dressing and we removed the dressing with clean gloves on. Then you're going to, from a safety feature, pull this up. Reach for the wings, and it goes straight up, and that's how it finishes. This part cannot hurt me. The needle is behind this little casing right here, so it's passive. It does not allow yourself to get stuck, and then this would go in the sharps container, of course. A Portacath gets flushed using sash, saline, administer the antibiotic or medication of any kind that you're doing, saline, and then heparin, using 100 unit per ml heparin typically. If the Portacath is only being maintained, let's say the patient, frequent UTI patient that has a Portacath, and they're not going to use it for a while, then a Portacath, the same prep is done. This, just like you're going to actually leave a dressing on, and when you insert the needle and you flush with the saline and the heparin, you flush with the heparin, the 100 unit per ml heparin, so that it sits inside that Portacath for the whole month. You can then remove your needle and throw it away in the sharps container. So once a month of 100 unit per ml heparin is the maintenance protocol for a port. And that is our supply review for Portacath. Thanks for joining us.